Good morning, everyone. Thank you so much for joining our very first webinar of the budget season. We know that you are coming in from the waiting room, you are getting your screens set up, and maybe grabbing another cup of coffee because it has been a long week. Okay, let's get started. Thank you so much for being here with us. This is our very first budget webinar series. We're going to be talking about the executive budget today, and I am so thrilled with the presenters that are here and ready to speak with you about their issue areas. I cannot wait for you to learn from them. I'm sure you'll have a lot of questions, and they are here with some answers about what is in the governor's executive budget, what you should know, what you should watch, and what that means for the next 5 months of budget advocacy. So to just start us off with a quick overview of Advocates for Ohio's Future, I'm Sarah Hudasek. I am the coalition manager of AOF, and we are a nonprofit, nonpartisan coalition of state and local health and human service organizations, and we convene and coalesce around budget and policy solutions that help Ohioans live better, healthier lives. And I want to start, this is our first webinar of the budget process. So I want to start with an overview of the budget in Ohio. There are actually 5 different budgets in Ohio. There is the operating budget. This is kind of the budget. So if you hear advocates say that they are working on the budget, they're probably talking about the operating budget. And that is introduced as House Bill 96 in this legislative session. And the operating budget appropriates, of course, operations programming and supports for the government, the state government, cities, counties. Funding goes to nonprofits, to programs in your communities, probably just about everything that you think of when you think of how you interact with government in your daily lives. A lot of that is appropriated through the operating budget. There's also the transportation budget. This appropriates funding for highways, highway safety, public transportation. That's House Bill 54. And then these next two are normally talked about in tandem. They're the Bureau of Workers' Compensation budget and the Ohio Industrial Commission budget. Those are House Bill 80 and 81. So those 4 budgets are all happening all at the same time right now. And then there's the 5th budget, the capital budget, that happens in even numbered years. So thankfully that one we can shelve until next year. And the budget is $218 billion in all funds over state fiscal years 2026 and 2027. So all funds means it includes state revenue from taxes, fines, fees. It includes federal funding. It includes federal pass-through funds that go through the state on their way to local governments, on their way to nonprofits. So it's a lot of money, and the budget includes policy provisions as well. So not just appropriations, but also policy changes that don't include any funding that can make changes in the programs that we're watching. So really quickly, the budget right now is in the House of Representatives in Finance Committee. Finance Committee Chair is Representative Brian Stewart. The Vice Chair is Representative Mike Davila. The ranking member from the minority party is Representative Bride Rose Sweeney. And finance hearings are already underway. They have begun with informational hearings and invited testimony from cabinet directors. And there are 13 budget-facing committees, which is a lot. In past House of Representatives processes, we have had finance subcommittees, which is where the finance committee members break into issue area subgroups and talk about very specific parts of the budget. This year, they're doing it a little bit differently. They're asking the standing committees who consider legislation throughout the entire 2-year legislative session to also consider the budget. So there's 13 different committees that are considering budget provisions and will be receiving budget testimony from advocates like us. The finance chair has announced his ambitious plan to have the budget voted out of the House of Representatives on April 9th. That's a very quick timeline, quicker than what we've seen in the past. So we'll keep you updated if we are on track for that timeline. And then the budget will move over to the Senate, where the finance chair is Senator Jerry Serino. The vice chair is Senator Brian Chavez. The ranking member is Senator Paula Hicks Hudson, and we're still waiting to hear about the subcommittee process, but it will likely mirror the House Finance process with the standing committees considering the budget. Then the budget moves to conference committee, and the governor signs the budget by July 1st, which is the start of the new state fiscal year. This is a visualization of everything that we just talked about. So as you can see, we're at the very beginning of the process. The governor has introduced his executive budget. That's what we're here today to talk about. The House has begun their hearings talking about the governor's budget, and they're working towards the substitute budget bill, which is the House's first version of their changes. They will be able to make changes to the executive budget, and that's when we can really start to see the House's priorities. Then the omnibus amendment is the next step after that. It's an additional round of changes that's introduced all at one time in a big omnibus amendment. It moves to the House floor and then over to the Senate. Then, because the House and Senate will always have different versions, the budget will go into conference committee where those differences have to be reconciled. They have to produce one budget that goes to the governor's signature, and then the governor has line item veto power over appropriations items and policy items. And notably with the line item vetoes, the governor can only strike what is there. The governor can't edit or add anything. He can only leave what's there or remove it. And then on this next slide, I have a list of links, and this PowerPoint will be shared. This webinar is being recorded. You'll receive this PowerPoint in an email later this afternoon. How do you track all these moving pieces? Well, the Blue Book, which is the governor's as introduced budget, is available at this link on the Office of Budget and Management's website. The Legislative Service Commission is compiling red books, which are deep dives into each state agency, department, board, commission, talking about their budget, what their programs are, what's receiving funding, any of the policy changes that are in the governor's executive budget. That's all analyzed in the red books, and those are still being released now. So far, I think there are 2 cabinet agencies red books that are out, and that is the Department of Mental Health and Addiction Services, which is proposed to be renamed to the Department of Behavioral Health, and then the Department of Veterans Services. There's also a free bill tracking resource that's called My Ohio Legislature that's linked there. You can keep track of bills and committee activity. And then, of course, House committee listservs, which are helpful so that you can keep track of which committee is holding testimony on which day and what topics they are hearing testimony on, because there are 13. And so it's hard to keep track if you're not subscribed to those updates. So keep an eye out for these slides to come through. So with that, that is my overview of the budget process. I am so thrilled to turn it over now to Teresa Kobelt with the Ohio Provider Resource Association to tell you more about what OPRA is watching in the budget and what you need to know. Teresa, take it away. Oh, Teresa, you are muted.
It's just so everybody knows, I was muted a few minutes ago with Kelsey, and I said, maybe I got it out of my system for the day, and clearly I did not. So thanks, Kelsey. All right. So my name is Teresa Kobelt. I'm the Chief Innovation Officer at OPRA, which is the Ohio Provider Resource Association. For those of you who are not familiar with us, we are a member association for Ohio's providers of services to individuals with intellectual or developmental disabilities. Our mission is to build and serve a community of great providers, and our vision is that all people who rely on services and supports would get them from great providers. And we have about 200 members across the state, and they represent services, about a third of all the services that are delivered in Ohio to individuals with intellectual or developmental disabilities. So our biggest partner is the Department of Developmental Disabilities, and then obviously the majority of our funding comes from Medicaid. But interestingly, DODD and the services delivered through our system are not part of the this is probably getting way too in the weeds, but even though they're funded through Medicaid, they're handled a little differently, I guess is the best way to say it, than the rest of the Medicaid budget. So a couple things that we were keeping an eye on, and continue to keep an eye on, and are super thankful to see that the rate increases, there were really historic rate increases in the last budget, House Bill 33, both in intermediate care facilities as well as home and community-based services, and those rates have been maintained. Also, I feel like it's really important for the advocacy community in particular to know that the intention of those rate increases was to go directly to direct service professionals, people on the front lines. They were targeted at increasing both starting wages as well as the overall average wage. DODD did conduct, and the other health and human service agencies have as well, DODD did conduct a compensation survey, and it shows across the board that the rate increases did go to DSPs. They went to those frontline workers. So, it's a really important narrative and advocacy piece to let the legislature know that those rate increases did what they intended. We've seen just dramatic changes in vacancy rates, in applicants, in longevity. So I think that's a very important advocacy message that we all need to keep in mind going forward. The other thing that's really important to note, it looks like in DODD's budget and their Medicaid services line, it looks like we're getting a 12.2% increase. Again, really important to note that just fills the gap left by ARPA funds. That is not, it looks like new money. It is new GRF. It is just replacing ARPA funds. So there are no additional increases in the home and community-based services in particular in the budget. I think as we've talked to members of the General Assembly, it's been really surprising to us to learn that some of them didn't realize, have forgotten that those were funded in part with ARPA funds. So again, from an advocacy point of view, just make sure, as we're talking to people, they understand that increase is really about replacing ARPA funds. That was promised that would happen. It was discussed a lot in the last budget how those would be funded, but it still seems like news, and certainly would be news to new members of the GA. Then some other things in the budget, there is flat funding and continued funding, which we're happy to see, of initiatives around multi-system youth in the DD space. Also, their Tech First and Employment First initiatives, they're continuing to fund at the same rate as before. In the Department of Children and Youth's budget, early intervention, when DCY was created, early intervention, the Part C program in Ohio is one of the programs that was moving from the Department of Developmental Disabilities into Department of Children and Youth. And one of the things county boards in particular have been advocating for is increased funding for evaluation and assessment that has largely been funded locally by the county boards. And so there is new money in the early intervention line item specifically for evaluation and assessment of that 0 to 3 population. So our advocacy efforts are really going to focus on that home and community-based side of things, waivers. There is no new money, no additional rate increases. Meanwhile, in developmental centers, the starting wage is now over $20 an hour. Another increase is built in, and we just need to see that same thing across all service lines. We need to be able to keep pace with other services and really grow the home and community-based services. So there's currently no appropriation, no new funding to even address inflation, to be able to increase DSP wages at all. And we're also looking for kind of an ongoing mechanism so we don't have to go back and have this discussion every year, that there would just be a way to adjust those rates each biennium for inflation at least. We, as I mentioned, are not part of the Medicaid committee this year. We being DODD, is part of House Health. That's where the testimony is being heard. So it's our understanding that the director of DODD is testifying on the 26th of this month. And then public testimony, proponent testimony, we understand currently is going to be on March 5th and March 6th. We are putting together for our both our members and then just stakeholders in the DD system some template testimony, either written or in person, for people to use. If anyone has interest in that, I'm happy to circulate that to folks to be able to use once we finalized it. And I am happy, Sarah, if there were any questions. I have to stop my share I can't multitask.
No
Any
worries at
questions?
all. Thank you so much, Teresa.
Yeah.
That is perfect. If you have any questions, please put them in the Q&A box. We will be answering them as we go. And up next is Kelsey Bergfeld with the Ohio Association of Area Agencies on Aging. Take it away.
Excellent, Sarah. Thank you so much for the invitation to be a part of this webinar. It's so nice to be among such fantastic advocates who are insanely passionate about the issues that we work on, and want to make sure that you're right. Ohio is a great place for everyone to live. So like Sarah said, my name is Kelsey Bergfeld. I am the Chief Policy Officer with the Ohio Association of Area Agencies on Aging. And I'm happy to tell you a little bit about the Area Agencies on Aging, or AAAs, as I will call them, throughout the presentation. There are 12 districts and regions around the state. There are a number of counties included in those regions. And I will share each AAA is maybe called something different, but each AAA is really committed to providing resources and care and services to our aging population. We, of course, blend federal, state, local, and private funding to make sure that we can have services and capacity available for lots of folks. We also administer Older Americans Act funding and programs to reach hopefully every Ohioan as funds and everything as they are available. But we are excited about this next state budget. We certainly have some opportunities to address some of the needs that our older adults are facing, and particularly fill some of those gaps. Excellent. So our first and our highest priority here at the Association of Area Agencies on Aging is the Senior Community Services Program. So this is a GRF line item that goes directly to each of our 12 AAAs that provides flexible funding for non-Medicaid services. So our AAAs do things like eligibility and level of care assessments and screening for programs and waivers like passports, home and community-based services waiver, and others. But these services particularly are designed to help folks stay at home and safe with a little bit of support, a little bit of help in a number of these areas, and potentially delay and divert folks from that Medicaid program. So maybe folks don't quite reach that Medicaid eligibility level, but would certainly benefit from these services with a little bit of help and support. Things like meals, home delivered meals, congregate meals, housing assistance, as well as transportation, home modifications. We know that that is certainly a major factor when considering if someone is able to stay home safely, to have some of those supports, maybe a ramp, maybe it's some grab bars that again help increase safety in the home. Personal care certainly is also very important. A little bit of assistance, everyone can always use a hand. Also, these services are designed to help prevent social isolation, provide opportunities for folks to congregate. Maybe it's an activity, maybe it's, I know one of our area agencies on aging provides Tai Chi, which is fantastic. So it's activities and wellness. And these services are, of course, focused for adults who are at least 60 years of age, lower income, higher need, or cognitively impaired individuals. Of course, folks are assessed to be eligible for this program, and services are prioritized for those of higher need. And like I did say earlier, really what is so great about this program is that they were lower cost and less intensive interventions to, again, help keep folks at home. Like I said earlier, they do delay and divert from enrollment in the Medicaid program. They help reduce waiting lists for services. They help enhance health and wellness programming, of course, support family caregivers, and create structures that effectively prevent and address elder abuse and neglect. Really, I think that this is one of the most important programs for our state in helping our older adults stay home. Of course, we know that Older Americans Act programs also support a number of these services, but we know that the needs throughout our aging community have not kept up with funding, particularly on the federal level, and then these state dollars help, again, fill those gaps for some of those same services. I will also note, we know that Healthy Aging grants were a fantastic award and opportunity in the last state budget. They were $40 million of ARPA, so American Rescue Plan Act dollars, with the objective that are the same as the Senior Community Services Program, to certainly address nutrition needs, to address transportation, as well as digital literacy and other activities that would fall under the Senior Community Services Program. We were very excited and thankful for that award. It went out to 85 of our 88 counties and were certainly put to great use. We were able to help folks for the first time. I heard a great story from our AAA in Southeastern Ohio that an individual who was eligible for home delivered meals had been waiting for 2 years due to capacity and restrictions and resources in the program. Because of those influx of dollars, that person was able to get home delivered meals for that first time. So again, such a vital resource and help and support for folks. Those Healthy Aging grants were spent in less than 1 calendar year. So when we really speak to the needs that are out there, knowing that, older adults can certainly use a hand up, given, certain economic pressures after the pandemic, as well as just knowing that a lot of our folks are on fixed incomes. These programs, these resources are particularly critical. So what we saw in the governor's budget, that line item was essentially flat funded. We did see about $36 million, oh my gosh, I wish, $36,000 increase over the biennium for these programs. Really, our ask is $10 million per year, an additional $10 million per year. Right now, that program is funded at just about $10 million per year. We would like to see that doubled. With these dollars, we could see more individuals be able to receive the services that they're eligible for. We could see a focus certainly in those greatest needs in terms of home modifications, as well as housing assistance and nutrition. But we certainly know, and we also know that those dollars that we used to be awarded are not stretching as far. We know that services generally are costing more, materials cost more, transportation, logistics cost more generally. So this boost will help continue to fill those gaps and address those needs across the state. Fantastic. And I really want to thank Teresa. She did a fantastic job talking about provider rates that are in the budget. We were excited to see that those increases that we saw for direct service providers in the last state budget were maintained. And we also support the ask for a mechanism for a regular review of those provider payment rates and ensure that those reflect the real cost of care. So I'll do you one better from inflation. We want to make sure that the real cost of care providing these services is considered on a regular basis outside of the legislative process, if possible, by the administration, to ensure that those provider rates don't stay stagnant for 20 years like they did before the last budget. We want to make sure, again, that those costs are considered and that we don't have to continue going back to the legislature every budget to ensure that those improvements that we saw in staffing, in retention, in service plans being fully staffed, folks are receiving the full number of hours that they're eligible for of care, that continues. Excellent. And then the last real piece that we have been focusing on, we were very excited to see in the executive budget proposal that the personal needs allowance, which is a monthly award for folks in our nursing facility and assisted living facilities, receive to help pay for things like toiletries, haircuts, clothing, and just really, those little home reminders of home that really make you feel at home and more comfortable in your space, that was proposed to be increased from $50 a month to $100 a month. So this again will allow our folks in these facilities to feel just more comfortable in their space. It will help reduce their financial stress and really allow them to help better manage their care needs. So we are excited and we are very grateful that was included in the executive budget, and certainly hope that we continue to see that $100 rate make it through to the end. And then just wrapping up here, we'll share that the Ohio Association of Area Agencies on Aging is grateful to be also a part of another great coalition, the Ohio Aging Advocacy Coalition. You'll see a number of our members here on the screen, really united again to lift up the home and community-based services system. We developed a state budget blueprint that offers a number of opportunities and solutions to really strengthen the HCBS system overall. And I will, of course, include that link in the chat if you'd like to see a more comprehensive public policy platform that we've all united around. We hope to see, again, as the House process continues, some additional amendments, some additional focus put on the needs of our older adults. But we are thankful for some of the changes and the investments that we've seen in the executive budget, and are staying tuned for what happens next. We'll also share that the Department of Aging is being heard by the Children and Human Services Committee. The director of the Department of Aging is scheduled to testify next Tuesday, February 18th. And then a number of stakeholders, including my organization and others like ours, will be testifying on the 19th. So stay tuned, Children and Human Services Committee. Okay. Thanks so much, Sarah.
Thank you so much, Kelsey. Excellent. Really appreciate all of that overview. Next up is Tim Johnson with the Ohio Poverty Law Center, here to speak with us about lead. Thanks so much, Tim.
Thank you so much, Sarah, and I hope everybody can hear me. I'm Tim Johnson. I am a senior policy advocate with the Ohio Poverty Law Center, but today I'll be wearing my hat as one of the members of the Ohio Lead-Free Kids Coalition leadership team. Be speaking to you today about lead poisoning prevention and what's happening in Ohio's operating budget. So just for folks that don't know, the Ohio Lead-Free Kids Coalition is a statewide coalition made up of over 50 plus organizations that all have come together to end the scourge of childhood lead poisoning. This is just a sample of some of the many members that are make up the coalition. It does need to be updated a bit because AOF has also joined as a member, which we're extremely grateful for, and all the great partners that we have that are really dedicated to making sure that no child has to suffer from childhood lead poisoning. All right, so the problem, right? There is no safe level of lead in the bloodstream. And I know if you've heard me speak about childhood lead poisoning before, you've heard me say that, but it's something that bears repeating, right? Any amount of lead in the bloodstream is dangerous and can cause some very significant problems for children who have lead in their blood. Anything from, developmental delays to, delays in growth, cognitive issues, aggressive behavior. All sorts of things come from having any sort of level of lead in the bloodstream. Lead dust and from lead paint in old housing is the #1 way that kids get poisoned. And I know that there's been a lot of focus on lead in water, especially with the horrific, realities of things that have happened in places like Flint. But still in the state of Ohio, the #1 way a child is poisoned by lead is inhaling lead dust or consuming lead paint chips. It is the #1 source. Over 95% of children are poisoned that way. And unfortunately, 2/3 of our housing stock was built before 1980. And it's estimated that more than 427,000 kids under the age of 6 live in these houses. And that's important because we know that was when lead paint was outlawed. So a lot of these older homes still have lead paint, whether it's been painted over. It doesn't matter. The paint is still underneath there, and it still represents a hazard to kids. And every county has young children in housing with potential lead hazards. And that's something I really want to.
Tim, did we lose you? Tim, if you can hear us, I think that we might have lost the connection. Okay, no worries. It is a Friday and technology is always keeping us on our toes. Let's take a quick break from Tim's presentation. Tim. Oh, you're muted. Hold on one second. You're muted.
Sorry about that. We must have had some sort of power surge or something because things sort of clicked off, but we're back. So sorry about
Fantastic.
that. My apologies for that.
You're great.
And just to finish up the slide really quickly, because I know that I just, blinked out of existence for a second there. Ohio has a really high level of kids testing positive for elevated blood lead levels. It's double the national average, and we have the second highest rate in the country, just behind Nebraska. So it's a serious problem in the state of Ohio. All right, so just to talk briefly about what we're seeing in the state budget as of right now. Unfortunately, the lead abatement line item within the Department of Health, which is the main way that Ohio's Department of Health, which is the primary state department that handles lead poisoning prevention, has seen a cut in the fiscal years 24 and 25. So the last budget, it was at 7.5 million in funding. And for fiscal year 26, it's at 7.04, and 27, 7.06. It's roughly a $450,000-ish cut, which was, a little bit disappointing to see. We had hoped that the line item would be funded at around 12 million, which is in line with what Governor DeWine has requested for that line item before. And this time we are simply just not seeing the same willingness to invest in lead poisoning prevention that we have in previous budgets, which is unfortunate because the lead abatement line item does a lot of really important things, especially around testing. But it is also the home of the Lead Safe Home Fund, which is really an innovative funding opportunity where local governments or local nonprofits and other community groups who want to start a lead poisoning prevention initiative in their community, or local governments that have one already but want to expand its reach, can get grant funding directly from ODH to do that. And so we had hoped to see that increase and expand the reach and the numbers of communities that could be served by that fund. But with a cut, that's simply not going to be possible. We also didn't see any request for authority to allow Ohio to administer and enforce the renovation, repair, and painting rule. And for those of you that don't know what that is, in 2010, the federal government via the US EPA passed a rule that essentially says if you are a contractor doing work in a home built before 1978, and that's going to disturb lead paint in some way, or disturb the paint in the house in some way, you need to take extra steps and precaution to seal off vents and do tarpings and just keep folks safe, not to spread lead dust and lead paint when you're doing renovation, repair, or painting work. The US EPA is in charge of making sure that that happens, but they don't do a very good job of doing that. They are pretty understaffed in that area, but they do allow for states to take on enforcement of that rule themselves. In the previous two budgets, the governor introduced a request to allow Ohio to administer the RRP rule was included. In this budget, it was not, which is unfortunate. It is a primary prevention tool, which means it helps keep kids safe from being lead poisoned in the first place. And so we're a little disappointed not to see that included, although we will be working with legislators to hopefully get that put in at some point in the budget. And I just want to make sure, oh, yeah, go ahead. You can, yeah. I just want to make sure that folks understand that there is no cost saving by shortchanging lead poisoning prevention, because every child that ends up poisoned by lead in the state of Ohio is a policy failure. Kids are relying on us to keep them safe, right? They can't keep themselves safe from lead poisoning prevention. They don't ask to be poisoned or be put into these situations, and neither do their families. And so they're really making sure that it's us looking out for them and making sure that they have healthy and stable housing in which to live in that's safe for them. And childhood lead poisoning is a problem we can actually solve. We are not creating any more houses with lead paint in them. Once lead paint was outlawed, houses built after 1978 do not have those hazards in them. We just need to take care of the ones we know that are older and still have those hazards in them. Lead poisoning prevention represents a cost savings. For every dollar spent, there's a $17 return. So it makes sound fiscal policy to invest. But if we don't spend now, we will pay for this down the line, right? We will see kids who are more likely not to be ready for kindergarten, less likely to be reading at a grade level, more likely to interact with the juvenile justice system as children, more likely to interact with the criminal justice system as adults. And so there is a cost to not investing in making sure that kids are safe. There are societal costs, there are fiscal costs, and we will certainly pay them down the line if we don't invest up front. And just want to make sure that everybody keeps that in mind, that keeping kids safe actually saves money and helps communities. And it's an important thing to do. So thank you, Sarah, for this opportunity to speak on this. And I apologize about momentarily blinking out of existence.
No, thank you so much, Tim. You are quick on your feet, and you came right back as if nothing had happened. Thank you so much for that great presentation. Next up is Joree Novotny with the Ohio Association of Foodbanks, coming right off of an extremely successful advocacy day at the State House on Wednesday. So, Joree, tell us what you're watching.
That's kind of you to say, Sarah, and thanks to those of you on the call that were able to join us this week at our our Friends of the Foodbanks Partner Advocacy Day. We took about 100 legislative meetings, had 150 or so of our closest friends join us for the day. I had good attendance at our luncheon from members and staff, so we're optimistic. With that said, I apologize. I'm not as prepared as your prior panelists with slides, given how we've been spending our time this week elsewhere. And we were also digging into where our core funding in the state budget stands to keep food moving out to our statewide food pantry network. So I'll probably be a little bit more brief, but I'm just gonna summarize for you that the Ohio Association of Foodbanks has long been grateful for and enjoyed the bipartisan support of 5 gubernatorial administration and a dozen or so general assemblies for our state-funded food programs. These programs help us further leverage what we're able to generate from our charitable network in terms of thousands of volunteers that contribute hundreds of thousands of volunteer hours, 100 million or more donated pounds of food that we source every year, in addition to the generosity of local individuals and communities that do their part generously and chip in to help make sure that no Ohioan goes hungry. Traditionally and historically, state-funded food programs have made up about 20% of all of the food that our statewide hunger relief network distributes each year. It's really critical food. It's the healthiest and most wholesome and nutritious food that we're able to source. While we have, in food banking, we are all about rescuing surplus food wherever we can find it and keeping it from going to landfills. We also know that people deserve and need center of the plate foods, fresh fruits and vegetables, dairy and protein, so that they can, the kids can go to school and learn and grow. Adults who are caregiving and going to work can focus and be productive. And older adults and people with disabilities have the basic needs met day to day. As you can imagine, pressure on our system has been increasing year over year. There's several factors for that. A couple of years ago, almost to the day, we saw SNAP emergency allotments end at the federal level that had been in place for more than a couple of years during the pandemic era response. That had really helped cushion the most devastating impacts of access to nutrition for low-income Americans. That was $126 million in fully federally funded SNAP benefits that disappeared overnight. And our charitable hunger relief network was never built to be a frontline grocery store. So the loss of those benefits and that purchasing power at our local grocery stores, combined with the year-over-year inflationary pressure and rising consumer prices for, again, food, housing and utilities, transportation, childcare, and healthcare, has obviously ultimately created a situation where low-income households have little to stretch to afford food. So we often see food as an early indicator of more downstream indicators that we're likely to see. And I'm sure, you know, my colleagues at the Coalition on Homelessness and Housing and who work in housing advocacy are starting to see the ripple effects. So before people start to face housing insecurity and homelessness, they first are facing hunger, right? Because food is the one thing that no one's going to come collect a bill on. So the rent eats first, the mortgage or property taxes eat first, keeping the gas in the car to get to work, keeping the car running, you know, keeping the heat on in negative degree weather in Ohio, those things come first. And then increasingly food is being sacrificed. So from July through December of 2024, we saw more food pantry visits in any 6-month period in our 35-year history. Okay, so this is more than what we saw at the height of the pandemic, and we're sharing that message and raising awareness about that urgent problem with our partners in the General Assembly. Unfortunately, in the governor's as introduced executive budget, we received a funding cut of $7.5 million per year for our state-funded food programs. That's almost a quarter of all of the funding we have received over the past 2 biennial budgets. Compared to this current biennial budget, 23% less funding. Unfortunately, we're not seeing anything that looks like normal in our lines. And we don't want to have to turn people away when they come to us for help, but I will tell you, frankly, that we are lightening the load. We are serving each food pantry visitor right now on average statewide, and we have about 2,000 food pantries and then about 3,600 total hunger relief organizations and programs in all 88 counties. So on average at those 2,000 food pantries, we're able to provide about 5 days worth of groceries per food pantry visit. That's down from 6.5 to 7 days of groceries per food pantry visit over the past decade or so. We are lightening the load. We're already able to respond with less help than we otherwise would have been able to. We are, of course, absorbing inflationary pressure because we have to put fuel in the trucks to get the food out to all of our partners. We've got to keep the perishable food moving in and out and stored safely. We have to have truck drivers that, you know, we're keeping employed. So we're under pressure on those basic costs as well. We're looking to restore those cuts that were included in the executive budget and have real frank conversations about our champions in the General Assembly about, you know, what else they're willing and able to do to invest in people facing hunger. And the reality is that 3.4 million Ohioans live in households with incomes less than 200% of the federal poverty level. That makes them eligible for our food bank network. And that's a growing number of them are being forced to seek help from our network. Only about 1.5 million Ohioans are poor enough to qualify in SNAP and are participating in SNAP. And for those folks, their benefits aren't stretching far enough to meet their basic needs as it is. So we're trying to fill gaps that are growing in our federal nutrition safety net. We're waiting to see what comes down from the federal government in terms of reducing access to those programs or reducing benefits. And at the same time, we're looking at almost 2 million additional Ohioans that don't have incomes and wages that are getting them to self-sufficiency that are coming to us for help more often. So we have a proven successful model to drive food to healthy, nutritious, wholesome, and Ohio grown and produced food that would otherwise go moan under, in partnership with dozens of Ohio farmers and growers. Really a win-win-win. I'm going to drop a link in the chat to our most recent economic impact study, because we also create and maintain jobs in Ohio's agricultural industry by rescuing this food and distributing it back out. Really appreciate your support and attention to this issue. Obviously there's many other issues we care about, but I just wanted to summarize where we stand in trying to leverage resources from the state to support hungry Ohioans. Thanks, Sarah.
You so much, Joree. There is a question quick for you about the statistic that you cited on utilization. I think that the question is about the number of Ohioans, the increase in neighbors visiting the food banks. Can you repeat that statistic, please?
Absolutely. So we collect household service statistics. They're duplicated, so that's based on the number of households and the number of people in those households that come to us, to our food pantries for help. We document children, adults, and older adults. And I can tell you that we served more than 4 million food pantry visitors in each of the last 2 quarters. So from July through September, and then again from October through December. We had never come anywhere close to that. In fact, if you go back about a year and a half, we exceeded 3 million food pantry visits in a quarter for the very first time. So that was on record by far the most demand we've seen from, as far as food pantry visits in a 6-month period at any time in our 35-year history.
Thank you so much, Joree. Great. Really appreciate your time. No, it's been such a busy week. It's been such a busy week for everyone on this call. Advocates are always doing 10 things all at once. Thank you. Next up, Darold Johnson with the Ohio Federation of Teachers, here to talk to us about education in the executive budget. We're excited to hear from you, Darold.
Most people aren't, but okay, thank you very much. I, like Joree, had a lot of things to do this week, so I apologize for not having the slides ready today. But the governor's budget has an increase of $11 billion in FY26 and 11.15 billion in 26 and 11.29 in FY27 for the foundation formula or base cost formula for education K-12. That includes joint vocational, charter non-public, which are private schools, and charter schools, STEM schools. So it covers the whole wide range of charter schools. The problem that we have, the concern that we have, is we're pleased that he said that he wanted to expand the fair school funding formula. That's the first time he said that in his budget proposal and actually put money into it. So that was a good thing. Our larger concern is, how do we account for the constitutional responsibility to fund public schools and make sure they have the monies that they need to serve the 1.5 million children that attend them, and divert monies to private schools. So there's about $1 billion that will go to private schools in this budget because of the way they do the formula. And the problem we have with that is we have so many needs, and the majority of kids do go to traditional public schools. We have a lot of traditional public schools that are fantastic and doing a great job in urban, rural, and suburban areas. And so we think the state should maintain its responsibility to making sure that that's their number one priority, to make sure that we have good public schools and that they were well funded, to make sure that every Ohioan, no matter what their zip code is, gets a good education. And so that's what we're looking for. We will be pushing the legislature to make sure it updates its funding for special ed children, for gifted children, for and for economically disadvantaged children, so that they supplement the base cost formula. The other piece that we're looking at is, how do we deal with the property tax issue? The state still does underwrite some property tax for previous levies. So there's about 1.29 billion for that effort in 26 and 1.31 billion in FY 27. Those that deal with property tax rollbacks and homestead exemptions for school districts. That's going to be another issue about how we deal with the property tax, because how you adjust property taxes will also impact what school districts receive from their local levies. So that's important that we understand how that impacts and how do we respond to the growing needs for some property tax relief. That's one of the things we'll follow carefully. The Ohio Federation of Teachers not only represents K-12 teachers, we also represent higher ed faculty. We have 4 community colleges where we represent staff, and for higher ed issues, we are interested to see that the SSI state share of instruction, which is sort of the base cost for what universities get for their tuition that goes toward their tuition, gets a little bit of an increase. Not when I say a little bit, a 0.1% increase in funding, and overall the funding doesn't keep up over the biennium for the inflation factor. And so there's like $100 million increase each year. That's not really going to help universities defray costs. They do put a cap in there for community colleges, capping any increase to $5 per credit hour for community colleges. But these caps or fees belie the state's responsibility again for public institutions. We are one of the states that with the highest cost for higher education. And so we need to make sure, or we should encourage the governor to do what he did 2 years ago, which was provide a dramatic increase in higher ed funding, which the House maintained and then got reduced later. So we need to go back to that increase for higher education to make sure we lower the costs of for students that attend Ohio universities and colleges. The other piece of that is OCOG, which is a grant for kids attending Ohio universities and colleges who need assistance. It's got like overall across the biennium a 5% increase. That's helpful. So make sure that those who have high need get some assistance in that effort for their college tuition. I say we represent libraries as well. Just one quick thing about that. There is a slight increase for the state revenue that would go to libraries. Libraries are part of education and a part of the whole community network services. And we're pleased that they got a little bit of an increase. We would like to see it go higher, but overall, we will hope to have more emphasis on the K-12 option of the budget, because that is going to be really where we sort of live and die with the next generation. That sort of wraps up my presentation.
Thank you so much, Darold. Yes, I know you were in committee for 8 hours on Wednesday, so thanks for joining us and being here with this overview. For all of our panelists, there is a question in the chat that I will ask after our last presentation. So start to think about what is the biggest action item for advocates to take in all of these areas. But last but never ever least, next up is Dr. Randy Leite with the Appalachian Children Coalition to tell us everything that ACC is watching in the budget. Please wrap us up, Randy.
Well, thank you. We are a little bit different in our focus in that we're more of a regional focus versus a specific issue focus per se. And so we try to capture a whole lot of stuff that's relevant and important in Ohio's Appalachian region. Just as a reminder, for those of you who may not know, this is what is officially Appalachian, Ohio, is designated by the Appalachian Regional Commission, 32 counties, about 40% of the state's land mass, about 25% of its people. And as you can see, stretching from Lake Erie along the river, just about to Cincinnati, and an area that's faces a number of issues. So one thing we're doing before we even get to advocating for certain policies or certain investments is we just try to spend a lot of time building awareness in Columbus about the challenges in the region. So just quickly, these are the kind of the top 10 things that we're always trying to promote understanding about, and I think those who spend their lives in Columbus, Cleveland, Cincinnati, other parts of the state may not realize how impactful all of these are. So everything we want to do is starting with where are the investments in the budget that will address any of these particular issues, just because they are so incredibly impactful and relevant. So that said, and as we looked across the budget, we've got dozens of things that we look to support. I just want to highlight a few of the things that are receiving the most attention among our partners in the region. So really, as we look at advocacy priorities, we're really looking in four broad areas that have kind of risen to the top. And again, not to say these are everything we're doing or everything we're promoting, but the ones that we're just getting a lot of momentum among partner organizations with what we work. So certainly one is increasing and expanding support for school-based health care and school-based services in general. We are working on a project now that is the process of building 35 school-based health clinics across our region in 20 counties. And that's certainly a huge investment by the state. But it really leaves many communities and counties still lacking health care. So we were pleased to see an item in the governor's proposed budget that would bring additional funding, 20 million additional dollars to support school-based healthcare expansion across the state, and are hoping that we can certainly see that come out of the final budget and move forward. Also related to that, though, is support for school-based health clinics. They are difficult things to operate in a sustainable way, and so we're advocating for ongoing technical assistance support, just to make sure those operating these clinics are doing so in ways that will ensure that they continue to operate. We're also very supportive of the Ohio C, the vision care proposal that the governor introduced. In our region, only about 36% of our kids are receiving vision care that they need. They may be identified with vision problems, but just over a third of them are actually getting glasses or other care. And so we're really trying to do what we can to support access to more vision care in the absence of providers in our region. And then also we're advocating for something that hasn't been in the budget in the past, but the notion of more support for schools to be community resource centers. In many communities in our region, there is nothing in that community but a school, maybe a school and a gas station. And so can we generate support for schools to provide more services, school-based childcare, after-school programs, access to services for parents and caregivers? So a lot of work in the school-based health and services space. We're also continuing to work on healthcare workforce expansion. In the state of Ohio, just as an example, in the behavioral health space, in the state of Ohio, there are about 700 citizens for every behavioral health professional in the state. In our region, there are about 2,800 citizens for every behavioral health professional. So just a critical workforce shortage, not just in behavioral health, but in oral care, primary care, other forms of tertiary care. And we have kids and families facing the difficult decision of having to travel often hours to receive care that they need. So trying to promote workforce expansion. We have a proposal that we introduced that is, as of now, in the governor's proposed budget, to create 3 curriculum innovation hubs in our region. And these would be hubs that would bring together higher education institutions, universities, community colleges, and also career and tech centers to develop more innovative, streamlined pathways to careers, to try to make it easier for people to pursue the education they need to move into healthcare careers. Also, continue to promote support for awareness building and internship programs, aggressive work with high school kids to introduce them to healthcare careers. We have a program of paid internships that we've run about 220 high school kids, put them into internships in healthcare settings where they've received some pay for that, and very much would like to see that continue. Not just ours, but some partner organizations doing some work in that space as well. We think there's a need for more support for recruitment and retention incentives for healthcare workers. Certainly, some of what was in the last budget and has come down the pike in the last 2 years in terms of financial supports for those pursuing behavioral health work. We very much would like those to continue. The Great Minds program as one example. Yeah, it's I think a wonderful idea. Maybe we could perfect a little bit its implementation, but I think those sort of incentives are addressing the problem, but they're not solving the problem. So we need to continue those. And then overriding it, just advocating for revisions to funding and how how services are reimbursed through Medicaid or through private insurance. So things that would, and really the advantage to that is it allows for the payment of a more living wage to people who are working in healthcare settings. Third area we're doing some work in is around foster care and kinship caregiver services. And one thing that's just a critical issue in our region of the state is the cost of foster care services for counties. And in a part of the state where large numbers of children are being removed from their homes, often tied to substance abuse issues in those homes. Some counties have realized a 500% increase in the money they're needing to spend to pay for foster care for kids in those counties. I talked to one Job and Family Services director the other day who said 4 years ago, they paid $1 million for foster care for kids. This year, they're projecting to pay $7.5 million with no additional tax revenues coming to them. And so this is a crisis level issue that often is not known or not understood. And so we're really working to see if we can find some support to address that. Also, we were very excited to see in the Department of Children and Youth budget, I think it was $8.5 million for a kinship caregiver navigation support model, and really trying to do a lot of work and highly supportive of that kinship caregivers, grandparents, aunts, uncles, taking care of kids and their families receive less support than other foster parents do, and often are left to their own devices in terms of how to care for kids. And so we think the idea of kinship caregiver navigation is hugely important for our region and the state. And then finally, we're doing some work in the early childhood space, and we're pleased with some of what the governor introduced in his budget. So certainly very supportive of maintaining and increasing access to high quality, affordable childcare for working families, and very much want to advocate for that. We find in our region there are two issues. One is lack of access to childcare in general. There just aren't enough childcare facilities for the number of kids that need it. But then also the affordability issue. So across our region, working parents are having to spend an average of 36% of their household income on childcare costs, over a third, and that's just not sustainable. So we're trying to advocate and work to assure access to high quality childcare, and then also ways to make that childcare affordable. And so certainly we think what the governor has proposed is a huge step in that direction. We're also supporting the enactment of the state child tax credit that the governor again has proposed. We think that the $1,000 tax credit for families with children up to age 6 is going to be an important financial support. And the fact that that tax credit gives those families flexibility in terms of where they can dedicate those funds and to meet their needs. And then finally, we are strong advocates for strong home visiting programs. So many of our families live in very isolated areas. They don't have transportation resources that they need. And I think bringing services in their homes, evidence-based home visiting through things like Healthy Start and the expansion of that program will be huge. In our region, the reality is we just can't always expect people to get the services. We just have to find more ways to bring services to people when they're living in very isolated communities. And then finally, I'll just mention if any of you are interested in attending, we do have our legislative briefing day coming up on Wednesday, March 5th. This will be a breakfast at the Ohio Chamber of Commerce. If any of you are interested in attending and having a chance to meet with members of the legislature, we invite you to please do so. We'll follow the breakfast with a formal session highlighting issues in our region, but I really very much want this briefing day to be a chance for us to create another opportunity for our partners and our friends to get in front of legislators. So if any of you are interested, you can see the RSVP there at the bottom, and we invite you to join us. I feel like I'm getting to know so many of you so well. I mean, one nice thing about the state budget is we come together for all these briefing updates and collaborative efforts, and so it's like, well, gee, I mean, you become like my friends now in my life. So happy to have you join us at our breakfast. So with that, I'll stop, Sarah.
Thank you so much. Yes, we need friends who are going through the same things that we are and advocating alongside us. So we have a couple of questions in the Q&A that are directed to all of the panelists here. And I think these two, they go hand in hand. So first of all, what is the biggest action item for advocates in these areas at this time? And then how do I stay up to date? How do folks keep in touch with each of your organizations and your issues? Teresa, would you like to kick us off?
Sure, that's just because I turned my camera on. I thought everybody was going to join in. I think I shared on our slide, our biggest action item really is making sure that the home and community-based side of our system keeps pace with some of the other services in our system that are more facility-based. We support services across the spectrum, as I know Kelsey and aging, similar situation. So really making sure that we are keeping pace on the home and community-based side of things and not getting into the 10, 20-year range of increases in wages for direct care professionals. So that's really our biggest, that will be our biggest focus of advocacy. Unless a change happens where the rate increases aren't maintained or something along those lines as of right now, as far as the as introduced goes, that's really what we're looking for. For our members, we keep them updated, obviously, through, we have actually weekly calls with members, send out regular communication. I am trying to think, my own LinkedIn is a place where I often post things. And then obviously Sarah AOF puts out a lot of action alerts and things for everyone in the AOF kind of community. So I think those are my answers.
Yeah, that's great advice. Social media is a great way to stay up to date. And I know, Randy, with the legislative breakfast, that's a great action item for advocates to take. Is there anything else that advocates can do as kind of a to-do list after this call? And how do folks stay up to date with each of our organizations?
Yeah, I guess I shouldn't have turned my camera on either. I guess you turn your camera on, you're up next, right? And as opposed to having more time to think about it. No, I think for me, um, yeah, a big message at the macro level is, look, we have a governor who, in his as introduced budget, prioritized children and families. And he's been on the record for a long time as saying those are important areas. And I think as we work with members of the legislature, just to continue to push for that notion that, look, our families, our children, they're our state's greatest resource, our state's greatest future, and keeping them front and center, I think is just critically important, and I think going to be a real struggle, in all honesty, in terms of some things we're hearing from legislators. I think so at that macro level, I think just we just want to promote everything we can that is resource to the kids and families, and also in light of so much uncertainty at the federal level right now, right? I just think, state investments are going to become even more critical. The other thing we try to do, and again, we're a regional entity, but I think trying to promote an understanding among the legislature that there are populations in our state that maybe are not well understood but have critical needs, right? And how do we make sure that we don't have populations that are forgotten about or even thrown away, that our state just chooses to toss them aside. And so, that sort of awareness as well. As far as keeping informed, I don't know. I feel like one challenge for me, I've got 3 calls today that I'll be a part of about legislative budget update stuff. And one thing I've noticed, there's a lot of people joining those with me, but then there's also others that are not. And I think to find the best single sources of overview information. I mean, that's one thing I like about being part of AOF, right? I think you guys, Sarah, do a great job of coalescing everything, and I think it's important that we all find our 1 or 2 sources of that information that we can rely on and have a chance to integrate with people. So I think calls like this and the work you're doing are going to be hugely important. It's like so much else. None of us are going to get anywhere, or not very far, if we're all in our silos trying to do this, right? And so that's one thing I'll say about our briefing day is we decided we don't want it to be a briefing session on what we want. We want it to be an opportunity for anybody who wants to work with kids and families to get in front of people. And so if I think if we can do more of that, sharing of support and pushing for things, collaboration is going to be a key approach for us all, right?
Absolutely. Yeah, great. I always appreciate a plug for AOF in our in our webinars and our work. Yeah, if you come on camera, I'm gonna assume that you're next. So Kelsey.
A willing sacrifice. I'm just kidding. I will second social media for sure. I know that's how I know AOF and my organization, if there is a specific call to action, particularly if it's a time around, amendments are due and there's a strategy around volume of contacts and such, which can certainly be helpful. Social media is where that comes out first. I know my organization has a monthly newsletter. Sometimes that's not fast enough to get out the news. So that is a good kind of quick glance if you follow those organizations whose missions you really care about. Second, I would also just remind folks that this is the very first step in this process, and to certainly pace yourself. We are 2 weeks into a 5-month process. We know that we'll go through at least 4 major amendment rounds for the bill, where whether you liked what you saw in the executive budget or you didn't and would like to see some changes, there's still so much time to engage your legislators and to stay rested up, to not feel disappointed by what you see in that version now, because there's so much time to change, so much time to affect the outcome, and certainly stay motivated.
Such a great message. Oh my gosh. Tim.
Yeah, if you're interested in the work of the Lead Free Kids Coalition, feel free to reach out to me. We have monthly meetings about what we're doing at the State House, what's going on. Would certainly love for anybody to join. You don't have to be a member of an organization. We have parents who just join, and people who are interested in the topic. So always feel free. And we can also sign you up on our email list where we will send out action alerts if something specific is happening, if we need folks to do calls or send emails, anything like that. Certainly happy to add folks to the email list as well. So yeah, we'll love to stay in contact with folks who are interested.
Excellent. And there is a great question in the Q&A about inflation. Inflation is affecting all of our areas, all of us in our individual lives. The gap in buying power of our collective allocations is widening by the day. Flat funding is not maintaining the status quo. In your conversations with legislators, have you gotten any traction on kind of pushing back against that flat funding challenge?
I can go first. We have not been successful using inflation as a talking point. It is specifically return on investment. If you have a dollar amount that you have found through research that comes back from every dollar that is invested in a certain cause, which I know many of us do, we certainly do. I have found that to be much more persuasive to particular majority legislators than just inflation in general.
Yes.
Not that it's not true.
Yes. And I know I'm the one that introduced the inflation word. So I'm sorry. The real cost of care is a way better way to talk about it. And the other thing that does seem to be resonating with a more conservative General Assembly is unfunded mandates. So there are an administrative waste and burden. There are a lot of things within our system that providers don't get reimbursed for that are not part of the rate that they're still required to do. So when we think about that real cost of service delivery, I mean, Kelsey's absolutely right that it is, and those words, the unfunded mandates, administrative waste, or burden, seem to be resonating more with this General Assembly than talk about inflation.
Yeah, I guess I would just echo all of that. We've had no traction at all, and we try to paint cases, you know, as in the food space, for example, when the only place you can buy food in your community is the corner gas station. I mean, inflation gets even more magnified, right? Because yeah, and yeah, we're not getting a lot of resonance around that. Yeah, the statistic I threw at all of you about 36% of household income going for childcare costs. I've yet to see even eyes perk up when I mention that to anybody. So it just doesn't seem to be an argument that is carrying the day in much of a way.
Yeah, I agree with all that. And I would agree with what Kelsey said. If you can show a return on investment, or if you can show how, if your programs or issues have gotten funding previously, how they've managed to expand or serve more people, that sort of thing is typically the data that this legislature particularly seems to be more responsive to. So, you know, any sort of positive growth, any sort of, you know, positive outcomes, any return on investment numbers are typically the things that will move some members of the General Assembly more than simply pointing out that inflation exists and that things are more expensive, and you know, flat funding isn't, you know, necessarily carrying the same amount of weight that it used to. So.
Mm-hmm.
And I do think that's why I had mentioned the compensation survey. I mean, when we looked at that, we can say there is data that now says, you know, the legislature made this investment. We now have data that shows that, you know, starting wages went up by 1/3, and meantime vacancies dropped by 1/3. So I mean, the things that they wanted to see happen with that investment are happening. The workforce is stabilizing. So I think using the data showing, you know, they asked for accountability and we were accountable. The surveys were completed. We had like I want to say a 97% completion rate on those surveys, which is phenomenal. So I just, yeah, any kind of data points showing accountability, not just return on investment, but I think accountability for the dollars. Those are the kinds of things that resonate.
Those are great tips, great advice. Kelsey, did you want to add something?
Sure, just really to add on what Teresa said and shared, and I know particularly if you have an increase in an ask for a line item, for me at Senior Community Services, it's $10 million, to be very specific about what you will use those dollars for. Again, and I know I did mention during my presentation, those dollars aren't going far enough, but I need to be able to say, as locally as possible, AAA2 is going to expand their home modifications program. AAA3 is going to address their wait list for home delivered meals, just being as specific as possible to those outcomes that you expect in the plan for those increased dollars will go much further than just a general ask.
That is excellent. Thank you so much. You have answered all of the questions that were in the Q&A. Thank you for your presentations, for your time, for sharing your expertise with us. We have to move through this budget together, and I'm so grateful and honored to be able to do that with all of you. Thanks to everyone who is on the call, and keep an eye out for a follow-up in your inbox with the recording and the slides. Have a great long weekend, everybody. Thank you.
Thanks, Sarah.